So, this is not medical advice. What is medical advice? What are the things that are required to make something medical advice? I would say that the content that we're creating is informational, it's lifestyle, it's entertainment, but it's not medical advice. The reason it's not medical advice is that medical advice requires comprehensive knowledge. Comprehensive knowledge requires you. You have to be involved in the equation, which is why when you go to a website or you read an article, that none of those things are medical advice either. And I'll give you some examples of the kind of situation where you, patient, the individual, is super important to the equation. There are many things that you would think would just be universal, say exercise. So I often, almost every visit, we talk about exercise of some kind. And when I talk about exercise, I'm recommending it. I'm telling people that they should exercise. However, there are a very small percentage of people who should not be exercising. If a person, say, is having chest pain that I think might be related to coronary artery disease or a clog in their arteries, then sometimes we're waiting for them to have a stress test. And while we're waiting, I say, don't exercise till we get that stress test and we can find out if there's something going on with your heart, because we don't want them to stress their heart. There are other situations. So for example, I'm telling people on a pretty regular basis they can take Tylenol and ibuprofen for their pain, and they can even combine Tylenol and ibuprofen. But there are definitely a pretty sizable group of people that should not be taking ibuprofen or NSAIDs, which are non-steroidal anti-inflammatory drugs. And those drugs have several effects. One is that they can be hard on the kidneys, and if someone has reduced kidney function, then they can't be taking those kind of medications. It's also hard on the stomach. So if people have ulcers or they have some kind of irritation to their stomach, then they shouldn't be taking those types of medicines, those NSAIDs like ibuprofen and Advil and those kinds of things. So even though in general, for most people, they can get away with it just fine and they're helpful drugs, for those particular people, then the comprehensive knowledge that's required would not be included. Another situation where the comprehensive knowledge is very important actually isn't related to the individual, it's related to the situation that they're going to be involved in, basically travel. So I think it's not necessarily intuitive that when you travel someplace and you're trying to get medical advice about that, it's a pretty detailed process. We usually make those long visits in a clinic because we need to check all the places that they're going to be going to find out what kind of medical advice we're going to give them. And this is probably one of the things that we get asked about as if it's a short answer when it's not a short answer. In a perfect world, medical advice would be fast and easy and not require too much effort. So it's not surprising that people want those things. Even in medicine, we want those things. In medicine, we call it the curbside. So let's say I'm taking care of somebody in the hospital and I run into the cardiologist in the hallway and I want to ask them something about my patient. And I think it's going to be a short little question. And so oftentimes we're happy, both parties are happy to just have a short conversation and just answer a short question. But oftentimes that short question becomes a longer question because I don't know all the things that I don't know. I don't know what he's going to say or she's going to say when I ask them the question. And it's kind of like, a curbside is kind of like the junk food of medical advice. It could be something that you can get fast and easy and free, but you have to be careful because there's a lot of danger in that. So sometimes if I'm asking a specialist about a patient, at the end we decide, no, it's not going to work. They've got to actually come and see the patient, or I've got to refer the patient to them in order for it to be medical advice, because the comprehensive knowledge that it takes to actually answer the question takes a lot longer than the 5 minutes we're going to spend chatting. So you could get to comprehensive knowledge about a particular question in 2 minutes. It could take 45 minutes, or it could even take a relationship. I've been in doctor-patient relationship with certain patients, and it's taken me 2, 3, 4 visits to really get to that comprehensive knowledge about a particular thing that's happening. And that's why these relationships are so important in medicine, and we've got to have that ability to take the time to get to the comprehensive knowledge that we need to get to. I'm sure you've got lots of things to do, so I'm going to let you go. I'll see you next time.